the number one antibiotic for ear infections is amoxicillin.
That part is true. Amoxicillin is first-line treatment for many pediatric ear infections because it's safe and well-studied. I'm a pediatrician and mom of two, and let's break down this video.
And what is an amoxicillin, guys? Red 40.
This is where things start to go a little wrong. Amoxicillin is the antibiotic. Red 40 is sometimes the coloring that is added to the liquid version. Those are not the same thing.
When your medicine is colored pink that you have to give to a 4-month-old, you're just giving red dye to a 4-month-old.
That's misleading. The dye is a very tiny inactive ingredient. The medication is what's treating the infection. The amount of dye in a short antibiotic course is much smaller than what kids typically get from a brightly colored drink or processed foods.
Not okay.
There's actually no pediatric guideline recommending dye-free antibiotics for most children. It can be a preference for sure, but when we prescribe antibiotics, the risk we're treating is the infection.
What do parents do? Request for your antibiotic to be compounded. They can compound amoxicillin. No, it's not going to be covered by insurance, but you can get it compounded without food dyes.
Some pharmacies can compound dye-free versions, and this isn't something most families need to do. Compound medications are often more expensive, harder to find, especially harder to find on nights and weekends when inevitably that ear infection happens. If your child seems especially sensitive to food dyes, it's reasonable to ask for these options. But part of treating infection in kids is actually making sure they get the medication. Coloring and flavoring help with that. So when pediatricians think about risk, we're thinking about whether the infection gets treated, not just whether the medicine is pink.